The top stories tonight in Y News. President Rodrigo Duterte halts the implementation of the controversial car seat law.
Owners of motor vehicle inspection centers have agreed to lower its inspection fees and suspend the collection of re-inspection fees from motorists for a year.
The Food and Drug Administration has granted the Presidential Security Group a compassion license for the use of China's Sinopharm vaccines.
Manning agency that allowed new COVID-19 variant students back in Quezon City to face charges.
Millions of Pfizer vaccine doses in Japan are likely to be thrown away due to the lack of special syringes.
And no wearing two masks is better than one, according to a study.
Good evening, Philippines and the world. Today is Thursday, February 11, 2021. Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I am William Theo.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I'm Angelo Castro III.
First in the news, President Rodrigo Duterte has decided to defer the implementation of child car seat law, adding that the controversial motor vehicle inspection system would no longer be mandatory. Rosa Licos explains why.
Amid criticisms and complaints, President Rodrigo Duterte ordered the deferment of the implementation of Republic Act No. 11229 or the Child Safety in Motor Vehicles Act. The new law obliges private motorists to use car seats for children younger than 12 years old.
Nagdesisyon na po ang ating presidente. Ipinagpaliban po or deferred ang pagpapatupad o implementasyon ng child car seats.
Other than the criticisms, some lawmakers also appealed to suspend the implementation of the law because of the people's plight amid the pandemic. Secretary Roque clarified that because of the decision of the president not to implement the law, this will be the basis to amend the law. Meanwhile, the chief executive also ordered not to make the motor vehicle inspection system of the Land Transportation Office mandatory. This following complaints from legislators and citizen groups regarding the expensive charge on the annual vehicle registration. The inspection fee of the LTO's MVIS cost around 1,500 to 1,800 pesos. The palace reiterates that the president's decision considers the needs of the public amid the pandemic.
Hindi na po mandatory ang MVIS. Ibig sabihin, kinakailangan wala pong bagong singil, walang karagdagang singil para sa pagpaparehistro ng mga sasakyan.
Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
Private motor vehicle inspection centers have agreed to lower their inspection rates in compliance with the government's call to ease the burden of Filipinos affected by the pandemic. Joanne Nano tells us why.
Upon the negotiation with the Department of Transportation, the Vehicle Inspection Center Association of the Philippines or VICOAP have agreed to lower the inspection rate as an act of solidarity and a way of heeding to the call of motorists. VICOAP will comply with DOTR's appeal to lower the rates and level it with the current fees of private emission testing centers while there is a pandemic. They will also waive the re-inspection fee for public utility vehicles as well as private vehicles for 1 year. This means that from 1,500 to 1,800 pesos, the Pmvic rates will be lowered to 600 pesos for light vehicles, 500 for motorcycles, and 300 pesos for public utility jeepneys.
We have, as a group, agreed to operate at a loss and lower our fees. We acknowledge that MVICs are not mandated for vehicle registration. However, our work in PMVICs goes beyond compliance and regulation. This is about saving lives.
Meanwhile, the DOTR and the Land Transportation Office vows to comply with President Duterte's latest order that motor vehicle inspection system should not be mandatory for vehicle registration. The transportation officials will coordinate with Malacanang for further details on the new order and said that they will be releasing new guidelines on the matter. Despite this, the DOTR said that the PMVIC will still operate to accommodate those who wanted to submit their vehicles for inspection and assure roadworthiness.
Tatalima po tayo rito para hindi po tayo mag-cause ika nga ng kaguluhan at magdadagdag na pahirap sa taong bayan. Kaya yun po ang aming ipatutupad.
Sa amin po sa DOTR sa LTO, mananatili po ang ating pasilidad. Kasi gusto pa rin po namin bigyan ng ating motorista at mamamayan ng isang center kung saan pwedeng masuri ang roadworthiness ng ating mga sasakyan.
In the last congressional hearing, several lawmakers is demanding for the suspension of PMVIC following several complaints on alleged corruption and malpractices. Joanna Nano, UNTV News and Rescue. We serve the people, we give glory to God.
The Presidential Security Group can now legally use the Chinese firm Sinopharm's COVID-19 vaccine after receiving a compassionate license from the Food and Drug Administration. Meanwhile, a total of 600,000 doses of Sinovac vaccines are set to arrive in the country this month. Rosalie Cos will tell us why.
10,000 doses of Chinese Sinopharm vaccines have been granted compassionate special permit by the Food and Drug Administration for the Presidential Security Group or PSG to use. This paves the way for the PSG to use the unregistered COVID-19 vaccines. The PSG hospital will take full responsibility for the vaccines and will submit utilization and outcome report to FDA.
Nag-issue po ng compassionate use license ang ating FDA para sa 10,000 dosage ng Sinopharm. Ito po ay sang-ayon sa application ng ating Presidential Security Group or PSG.
The PSG became controversial after it was revealed that some of the close-in security detail of President Rodrigo Duterte were inoculated in September and October 2020. Meanwhile, the vaccines produced by Chinese firm Sinovac Biotech will be the first vaccines to arrive in the country, particularly the 600,000 doses of CoronaVac. According to presidential spokesperson Harry Roque, 100,000 doses of this have been donated by China to the Philippines for the military.
Ang bakuna po na Sinovac na galing naman po sa China, nakaukit na po sa bato ang pagdating. Ito po ay ang 23 ng Pebrero. 23 February, darating po ang Sinovac, 600,000, pero 100,000 po ay donasyon ng China para po sa kasundaluhan sa Department of National Defense.
The Sinovac vaccines will be stored while the FDA has yet to issue an emergency use authorization and will be sent back to China if the emergency use will not be approved by the health regulator. The personnel of the Philippine General Hospital, one of the hospitals set to receive the first batch of vaccines, are prepared to be inoculated by any vaccines approved by the government. One of the healthcare workers who will receive the first shot will be PGH spokesperson Dr. Jonas Del Rosario, a COVID-19 survivor.
Pagka ang bakuna po ay in-approve ng FDA, we will consider it safe and optimum. And whatever it is, we will have ourselves vaccinated.
Meanwhile, the arrival of the 170,000 doses of Pfizer-BioNTech vaccines through COVAX will be delayed, according to National Task Force Against COVID-19 Deputy Chief Implementer Vince Dizon. This is due to a hitch in paperwork processing. However, the vaccines are still expected to arrive within the month of February. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
Senate President Vicente Soto III is willing to get vaccinated in public in support of the government's COVID-19 vaccination program. According to the senator, he wants to lead by example to assure the public that the vaccines procured by the government are efficient and safe. Soto adds government leaders should step in and help convince the public because the government's vaccination information drive is a failure.
Members of the House of Representatives are pushing for the passage of a bill that will expedite the purchase and administration of COVID-19 vaccines in the country. Ray Palayo explains why.
House Speaker Alan Velasco filed House Bill 8648 or the Emergency Vaccine Procurement Act of 2021. This will allow local government units to procure of COVID-19 vaccine without having to go through public bidding. It will also allow LGUs to buy directly from pharmaceutical companies. Congressman Velasco said time is of the essence and each day of delay is very costly for the government. Velasco met with the Health Secretary Francisco Duque III and IATF Chief Implementor Secretary Carlito Galvez yesterday to discuss the vaccine program of the government. Meanwhile, President Duterte is set to issue an executive order that will allow local government units to pay more than 15% as down payment in the vaccine procurement as what is stated in the procurement law. San Juan City Mayor Francis Zamora said that AstraZeneca is asking for 20% down payment as stated in their tripartite agreement.
May pera naman po ang LGUs, may pera ang national government. Ang tanong na lang, ano bang tamang proseso na papagdaanan upang hindi naman din kami makasuhan bilang mga mayor.
MMDA Chairman Benhur Abalos Jr. assured that the executive order is about to be signed.
Dahil may kalamitan po tayong ito dahil po yung pandemic, pwede naman itaasan po ng presidente ito dahil tumutulong talaga po ang mga alkalde. No? At ako pa na sinabi ko, tripartite naman to. So bago mag-advance payment para hindi po mapahamak ang ating mga mayor, ay gagawa ng executive order. Nakausap ko na po si Executive Secretary isang araw at nakita ko na po yung draft at ilalabas na po ito.
Meanwhile, Malacanang has yet to respond when exactly will Duterte issue the EO. Ray Palayo, UNTV News and Rescue. We serve the people. We give glory to God.
National Task Force Against COVID-19 Chief Implementer and Vaccine Czar Carlito Galvez Jr. says they are drafting a memorandum order for the President to certify as urgent a proposed bill expediting the vaccine procurement of local government units. The Senate Committee on Finance hearing tackled in today's hearing Senate Bill 2042, exempting the LGUs from compliance with certain procurement requirements. This include the prohibition to make advance payments under the Government Auditing Code and Local Government Code of the Philippines. The IRR of the Government Procurement Reform Act also limits advance payments as approved by the President to only 15% of the contract price. According to the Department of the Interior and Local Government, there is a need to enact a law, especially now that some LGUs are nearing its deadline for the advance payments to AstraZeneca under the tripartite agreement with the national government.
Really, time is of the essence here. The importance of trying to bring in the vaccine as soon as possible. And I'm sorry to say that our procurement laws prevent us from doing so. And if we do push for it, makakasuhan po ang mga LGUs ng COA at kung ano pang mga kasong itatapon sa kanila. Kawawa naman po ang ating mga LGUs.
Very politicized ngayon ang ating bayan dahil elections are coming up in the following year. Yung mga LGUs, ang worry po natin, nag-iingat din po. So they want to serve their people, they want to take risks, but wag naman sana to the point na maalanganin at makasuhan.
According to the Government Procurement Policy Board, or GPPB, a memorandum order is being drafted in the Office of the President to allow LGUs to make advance payments up to 50%. The board also allowed last year the emergency procurement for COVID-19 response. That is why vaccine purchases won't have to undergo public bidding. Meanwhile, the bill also seeks to allow LGUs to buy vaccines directly to vaccine manufacturers, to which a medical group opposes.
SB 2042 will lead to maldistribution of vaccines based on capacity to pay. The EUA issued by FDA is based on the declaration of a national emergency. The COVID-19 pandemic is not a local problem. Similarly, vaccines are not a local resource. prioritization and distribution requires centralized orchestration.
Galvez also explained that vaccine manufacturers would not transact directly to local governments because of the absence of indemnification law that will ensure compensation to vaccinees who will experience adverse effects. According to Galvez, the absence of the law also affected the country's chances to secure higher volumes of vaccines. The Philippines has submitted its draft of indemnity clause to the World Health Organization.
The significant volumes given by the COVAX and also by the manufacturer can be hindered without this indemnification law. Actually ngayon sir, supposed to be kung may indemnification law tayo, yung Pfizer baka February 12, nandito na po yun eh.
Health Secretary Francisco Duque III also said the PhilHealth has studied the creation of indemnification fund for government's vaccination programs. However, it was not included in the 2021 national budget. The senators also recommended to include a provision for the guidelines in the prioritization list of LGUs to avoid politicizing the vaccines. For those watching us on YouTube, please click the subscribe button you see on the right side of your screen and ring the bell for notification. You may also follow us on Facebook.
Armed Forces of the Philippines Chief of Staff Lieutenant General Cirilito Sobejana confirmed that Lieutenant General Antonio Parlade is under investigation over his social media posts red tagging a news reporter. The AFP, meanwhile, will still determine if the journalist is indeed a supporter of terrorist groups. Leah Ilagan explains why.
The Armed Forces of the Philippines Provost Marshal General is conducting an investigation on Lieutenant General Antonio Parlade's online comments against Tets Torres Dupas, a reporter of Inquirer.net. AFP Chief of Staff Lieutenant General Cirilito Sobejana said he wants to know if the statement of Parlade against Tupas is the official statement of the committee.
Instruction ko sa kanya na makipag-ugnayan sa Strategic Communication Committee ng NTF-ELCAC at tanungin kung itong mga sinasabi ba ni General Parlade ay with the blessing of that committee. Para sa ganon, hindi kami magmumukhang imbestigahan namin ang nakakataas sa amin, yet it is part of their strategic communication plan.
Parlade has recently tagged Tupas as propagandist and supporter of the communist group over the report she wrote on about the two Aitas who were allegedly tortured by soldiers in Zambales. Sobejana also said that the burden of denial is with Tupas once Parlade present his evidences to support his allegations.
Tulad ng sinabi ko, dapat factual tayo sa pagbabalita or pagsiwalat ng mga informasyon. Ngayon, nabanggit ko about burden. On the part of General Parlade, nasa kanya yung burden of proof na bakit sinabi niya na supporter si Ma'am Tupas. Kaya kung ma-prove naman mayroon siyang ipresentang ebidensya establishing that si Ma'am Tupas ay supporter, ang burden of denial naman na kay Ma'am Tupas. So, mas maganda nga mag-usap silang dalawa para malinaw ang lahat.
Sobejana also said that they will also probe if Tupas is indeed a supporter of the terrorist group.
Hindi rin natin ma-discount pa or ma-drop yung possibility na kasi sinulat nga kung if you write something, meron ka ring it is a dictate of your emotions or your sympathy or whatever. It will take some time for us really to uncover the truth, no? So let the authorities do their job to find out kung ano ba talagang tunay.
In a television interview, Parlade said he have a basis for calling Tupas a propagandist. Leah Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
In other news, House Speaker Alan Velasco maintained that calls to revive the franchise of media giant ABS-CBN will have to wait until the next Congress. In a statement, Velasco said the 18th Congress only has a year until 2022 elections. Thus, he said, the House of Representatives is bent on finishing the remaining priority measures of this administration to ensure that President Rodrigo Duterte fulfills his campaign promise to the Filipino people. On top of this priority legislation, Velasco said Congress is working double time to accomplish priority legislation such as the passage of the Bayanihan to Arise as One Act or the Bayanihan 3, as well as other economic bills geared towards rebuilding the Philippine economy following the impact of the global pandemic. Several lawmakers have moved to revive the media giant's franchise application by filing proposed measures to the same Congress that denied it in July 2020. Recently, President Rodrigo Duterte reiterated that he will not allow ABS-CBN to operate even if Congress grants a franchise unless the media firm settles its unpaid taxes to the government.
Investigators of the Bureau of Fire Protection are still investigating the cause of the ammonia leak that killed 2 persons in Navotas City last week. But the BFP has disregarded the possibility of welding works that could have caused the incident. Dante Amento will tell us why.
The Bureau of Fire Protection has collected some blast parts of the allegedly 40-year-old tank that exploded in a cold storage facility in Navotas City last week. The samples are now under metallurgic examination to determine the cause of the ammonia leak. BFP considers the age of the tank for possible wear and tear damage plus the high pressure of ammonia, and the tank was allegedly exposed to the sun. Mayor Toby Tiangco had recently disclosed that the ice plant, whose one of the owners is his mother, has been operating for 45 to 50 years. But BFP clarifies there was no explosive component and hot work operation or welding activity found in the area. The BFP is still gathering statement from some witnesses and need to finalize the process in the area, such as gathering of additional evidences. The Bureau is also waiting for the gas toxicity level to go down for them to be able to penetrate the area. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The Department of Health says there are no new cases of the new COVID-19 variant in the Cordillera Administrative Region. Meanwhile, health experts clarified that the case surge in Cebu City is not due to the B117 COVID-19 variant. Aiko Miguel explains why.
Authorities in the Cordillera Administrative Region conducted a fast testing, contact tracing and isolation of the close contacts of those who tested positive of the B.1.1.7 COVID-19 variant in the region. These are the reasons why there had not been no new recorded transmission in Bontoc Mountain Province and La Trinidad Benguet.
We're also not seeing as of now additional clusters occurring in CAR or even specifically in Bontoc or in La Trinidad. But yes, we need to watch out for and we need to really look into ano yung linkage ng mga cases nito. And I guess ang CAR ngayon is in heightened response to ensure, no?
Dr. Althea de Guzman of the DOH's Epidemiology Bureau says that there should be monitoring in regions, especially in provinces with high COVID-19 cases, so there will be no mutation that would result for a more transmissible new COVID-19 variant.
Pag dumadami ang kaso, tumataas yung chance natin na magkaroon ng mga mutations. Kaya yung isang mahalagang step natin para mapigilan, para ma-lessen yung chance natin na magkaroon ng mga mutation at para magkaroon ng mga bagong variant is to really push our numbers to as low, to as minimum number as possible to decrease the chance of new variants, even a variant coming from the Philippines.
Experts are also closely monitoring case surge in Cebu City. Based on UP Octa Research Team's report, there are only 7 cases daily that are recorded in Cebu City last December. But this month, there are now 129 cases per day, which is alarming according to experts. According to the DOH, it is not the B.1.1.7 variant, why there's a prominent surge of COVID-19 cases in the city, and UP Octa agreed with it.
We don't
have the evidence that the sudden rise is due to the UK variant. There is a possibility. So it's not, if we don't have the genome sequencing, it could be argued that it does not have the evidence support. But at the same time, the Department of Health is still working on the genome sequencing for samples in these areas.
According to experts, factors that affected the surge are the holiday season social gatherings and people being complacent in following minimum public health standards. Another factor is the delay to consult doctors of those experiencing symptoms and were exposed to COVID-19 patients. The DOH is strictly monitoring the situation in Cebu City. They have been coordinating with authorities there and also in the One Hospital Command to decongest and prepare hospitals once cases continue to rise. The DOH continuously reminds the public to be extra cautious and observe health protocols, especially amid the threat of reported COVID-19 variants. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The total number of coronavirus disease cases in the Philippines reached 543,282 after the Department of Health reported 1,734 new cases today. Of the total tally, 31,478 are active cases according to the DOH latest case bulletin. There were also 423 new recoveries, bringing the total of those who have recovered from the illness to 500,335. The death toll, meanwhile, stood at 11,469 after the disease claimed 68 more lives. Metro Rail Transit 3 General Manager Rodolfo Garcia has passed away. The Department of Transportation, or DOTR, announced on Wednesday night he was 77. On its Twitter post, the DOTR paid tribute to Garcia for his contribution to the improvement of the MRT3 system. In January, the DOTR said Garcia tested positive for COVID-19 and was admitted to the intensive care unit. The DOTR added that MRT3 Director for Operations Michael Capati, 36 other office personnel, and 6 Sumitomo Mitsubishi heavy industry staff also contracted the disease.
The Quezon City government will file charges against a manning agency in Manila City. JP Nunez will tell us why.
Due to possible violations of health and safety protocols set in place to fight COVID-19, a manning agency may face charges. This comes after the said agency allowed a person positive for a new COVID-19 variant to come back to Barangay Commonwealth. According to Quezon City Mayor Joy Belmonte, the manning agency has placed the community at risk for doing so. According to the Quezon City Chief Executive, among the violations seen is failure to notify the city government or even the barangay officials when the patient was allowed to return to an apartment in Commonwealth. The patient has been taken to a Hope facility together with other person living in the apartment. The patient is now isolated while waiting for the swab test result. The manning agency, for its part, has yet to comment on the issue. The Quezon City government continues to remind the public to follow the minimum health standards to avoid contracting COVID-19. Authorities are still mulling over placing the place where the patient resides under lockdown. JP Nunez, UNTV News and Rescue. We serve the people. We give glory to God.
The U.S. Senate impeachment trial of former President Donald Trump continues as prosecutors present arguments that he is responsible for inciting insurrection. Sonny Cos will tell us why.
House Democrats prosecutors in the second impeachment of former U.S. President Donald Trump unveiled chilling new security footage showing a mob or riots breaking into the Capitol last January. Video shows them smashing windows and doors, searching for the then Vice President Mike Pence and House Speaker Nancy Pelosi. Police heroism and cries of distress can also be seen in the video.
They did it because Donald Trump sent them on this mission, and his mob broke into the Capitol to hunt them down.
Likewise, tweets of the former president and comments were also shown as part of the first full day of arguments, as prosecutors argued that Trump was inciting insurrection and was no innocent bystander. Despite this, a conviction is still unlikely because of the lack of Republican support that will result in an acquittal of former President Trump. Stanikos, UNTV News and Rescue, USA. We serve the people. We give glory to God.
Millions of Pfizer vaccine doses in Japan are likely to be thrown away due to the lack of special syringes. Early Briones explains why.
The original 72 million people expected to be vaccinated in Japan has now been reduced to only 60 million people as the country struggles to extract the full amount of doses in Pfizer's vaccine vials. Japan is urging medical equipment manufacturers to increase the production of the special syringes, known as loaded space syringes, which are needed to extract the sixth and final dose from Pfizer's two-shot vaccines. Health Minister Naruhisa Tamura said on Tuesday that Japan's syringes can only draw 5 doses, and while they will be using all the syringes, they have left that can draw 6 doses. As more shots are administered, it will not be enough. Despite securing 144 million doses from Pfizer last month, Japan's revised number of deliverable doses has been reduced to 120 million. The shortage in special syringes, however, is not a unique problem to Japan, with countries in the European Union, the United States, and Sweden also scrambling to acquire enough loaded space syringes. Japan's inoculation program will be kicking off next week, starting with more than 10,000 frontline health workers, and the country will be aiming to immunize all people aged 65 and older, starting from the end of April. Early Briones, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, South Africa is weighing options to sell or to swap their stash of AstraZeneca vaccine for a different treatment. Mariela Toza explains why.
The health minister of South Africa said that they are considering of swapping its doses of AstraZeneca's COVID-19 vaccine and begin its inoculation campaign with Johnson & Johnson shots instead. South Africa received its first jab, which comprises of 1 million AstraZeneca shots on February 1. However, it suspended its vaccine rollout this week with Oxford AstraZeneca vaccine after a study found that the jab failed to prevent mild and moderate illness caused by a variant found in South Africa called 501Y-V2. This decision has delayed the plan to inoculate about 40 million people, which is about 67% of the population in South Africa by the end of 2021. Health Minister Zweli Mkhize told a press briefing on Wednesday that the government will continue with the planned phase on vaccination using Johnson & Johnson vaccines rather than the AstraZeneca vaccines. He also added that the Johnson & Johnson vaccine has been proven effective against the 501Y-V2 variant. However, it is yet to confirm as to when the immunization would begin. In the South African global trial, the Johnson & Johnson vaccine showed 89% efficacy rate in preventing severe disease and was found to be 57% effective against moderate to severe disease. 95% of infections observed in the local study were due to the 501Y-V2 variant, first identified late last year. Officials are also determining on what to do with more than 1 million Oxford AstraZeneca vaccines that have already been secured from the Serum Institute of India or SII, which are set to expire at the end of April, though that date can be potentially adjusted. The health minister also pointed out several options, including swapping or selling the doses with countries tackling the original coronavirus strain. He explained that further deliberations would be carried out on the AstraZeneca vaccine in South Africa. Mariela Toza, UNTV News and Rescue. We serve the people, we give glory to God.
Masks that are doubled up or fit better reduce people's exposure to coronavirus, according to a study. Marvy Delfin will tell us why.
The Centers for Disease Control and Prevention, or CDC, has updated guidance on its website on ways to make sure your mask works the best it can, as not all masks provide the same protection. One of two suggested methods to substantially boost fit and protection is wearing a cloth mask over a disposable surgical mask, while the second is improving the filtration of a single surgical mask by knotting the ear loops and tucking in the sides close to the face to prevent air leakage around the edges and for a closer fit. A laboratory experiment using dummies found that both of these methods reduced exposure to potentially infectious aerosols by more than 90%. Researchers say that an unknotted surgical mask blocked 42% of particles from a simulated cough, while a cloth mask alone blocked 44.3% of particles. When combined with the cloth mask over the surgical mask, 92.5% of cough particles were blocked. The study does have some limitations, as it only used one kind of surgical mask and one kind of cloth mask, when many other types are commercially available in the market, and so it cannot be generalized to all types of masks. Additionally, the findings cannot be generalized to those who might require a different fit, such as children and men with facial hair, and while double masking or tightening masks can optimize fit and improve mask performance, some people may experience difficulty in breathing or seeing. However, CDC says the study shows that there are ways to improve overall mask efficacy, and more research is needed on ways to improve masks. CDC Director Rochelle Walensky acknowledges that some people may be both tired of hearing about masks as well as tired of wearing them, but she said there is evidence that shows coronavirus infections and deaths have decreased when policies mandating masks are implemented. And so, mask wearing continues to be one of the best defenses against virus transmission, along with social distancing, avoiding crowds, and poorly ventilated indoor spaces, and practicing frequent hand washing. With the emergence and circulation of more highly contagious virus variants, CDC Medical Officer John Brooks emphasized that whatever we can do to improve the fit of a mask to make it better, the faster we can end this pandemic. Marvy Delfin, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, February 11, 2021. I am Horlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people, we give glory to God.